I welcome you all in the meeting in which we would be discussing about the importance of protein in women's health. We would be seeing how protein is important in PCOS, how protein is important in menopausal women, what are the various gynec surgeries which impact our muscle health of our women, and what is the role of protein in muscle health, and we would be introducing a few proteins to you, and then we would be telling you how protein is important in day-to-day women's life. So, protein deficiency in India is very common. The survey reveals that 71% of Indians have poor muscle health. 84% of Indian vegetarians and 65% of non-vegetarian diets are protein deficient. Indian vegetarian diets are 84% deficient in protein. This has been claimed by the Indian Dietetic Association. Indians are protein deficient and it needs immediate attention. A nation needs to have a strong foundation and it has to be done with high quality of proteins in a balanced diet. And this will help India to stay healthy for a long time. We would be discussing first that how gynec surgeries in our patients, in our women, affect the muscle health. We can see that there is reduced food intake after surgery. When the patient is admitted in the hospital for a surgery, we tell the patient after the surgery to eat less because the bowel movements are less initially. Protein intake becomes less than half of the recommended after surgery. There is less work which the patient after gynec surgery does, and so there is less appetite, and so there is also a more reduced food intake, and protein intake suffers the maximum. Patients after major surgery show a weight loss of 4 to 6% during the first 10 post-operative days, and this is not regained even 30 days after the surgery. Surgery causes immobilization, it causes deterioration in the nutritional status, the post-operative decreased food intake. All this leads to reduced protein synthesis, and there is decline in muscle function, and the post-operative muscle weakness and fatigue is noted. Infections and injury lead to further increased nitrogen loss and loss of lean body mass. There is an unmet protein requirement which leads to prolonged convalescence, diminished immunity, and poor wound healing. A patient who needs more protein to the tune of 1.5 to 2 grams per kg body weight takes even less than 1 gram per kg body weight. Bed rest and acute inactivity, which is associated with hospitalization or a disease state, poses a potent threat to muscle tissue and functional capacity. In young healthy adults subjected to bed rest, the loss of lower body lean mass appears to be to the order of 100 to 200 grams per week. Every major wound requires adequate protein and energy intake for healing. Every major wound significantly increases the nutritional needs to the tune of 3 gram protein per kg per day. A patient, a lady who is 60 kgs in weight, will need 60 into 1. That means 60 gram protein per day. This is the normal requirement. But if the patient or the lady has a wound after a gynec surgery or any open surgery, then the requirement increases 3 times. That means a 60 kg lady would be requiring 150 to 180 grams of protein per day for a good wound healing, and so that she can return to a normal activity as soon as the wound heals. One of the key aspects of perioperative care includes early mobilization, and we do this in our day-to-day practice that after every surgery, after every open surgery, we tell the patient to ambulate fast so that the protein synthesis and the muscle function will come back to normal as soon as possible. And laparoscopic surgery, in those patients, we tell them to come back to the normal activity soon after 1 or 2 days, and they are ambulated in our hospitals in just 6 to 7 hours after the surgery. In most patients, a standard whole protein formula is appropriate. Early post-operative food intake is advocated, and supplementation with protein powders is suggested in order to meet the daily requirement of 60 grams of protein per day. Gynec surgeries have a profound effect on health of women by affecting the muscle mass, be it hysterectomy or a pelvic organ prolapse, for a vaginal wall prolapse, or a laparoscopic surgery also, or a simple surgery like tubal ligation, which is just a daycare procedure. All these, to some extent, makes the woman rest for a few days after surgery. Maybe it physical problems, or it might be just psychological. All this will lead to, bed rest will lead to reduction in muscle protein synthesis, and there would be degradation of the skeletal muscles. Even laparoscopic surgery patients experience a fatigue in the first few weeks after myomectomy. So even laparoscopic surgery patients also face this problem of immobility, and this leads to muscle weakness and fatigue. And if we give a protein-rich diet during the convalescence period, then the improved muscle strength is definitely noted in these patients. Apart from this, even a small surgery like tubal ligation leads to estrogen deficiency to some extent, and this further decreases the muscle protein synthesis, and so protein intake has to be improved, has to be increased in women even after small, simple gynec surgeries. The stimulation of muscle protein synthesis is fundamentally regulated. What happens is that after every workout, after every muscle breakdown, there is muscle protein synthesis. Proteins is synthesized in the muscle itself, and this is regulated by extracellular and intracellular amino acid availability. Amino acid availability is modulated by several dietary factors, including the amino acid protein source which the patient is taking, the amount of protein which the patient is taking, the timing when she takes, the pattern how she takes. These factors independently and synergistically impact the rate of protein digestion and amino acid absorption. So protein ingestion is the key stimulus for preserving the skeletal muscle mass. What happens in a menopausal women? These women it is seen that they have frailty among them. Women who consume diets which are low in proteins, in the low protein group, had a higher body fat, and they had a higher fat to lean ratio than those who consumed high protein diet. That means that if a menopausal woman is taking less proteins, then her body fat also increases. The fat to lean ratio also increases. Upper and lower extremity function was impaired in those who consumed a low protein diet compared to those with a high protein intake. The higher body fat percentage was associated with a higher rate of non-communicable diseases. If the patient has a higher body fat, then she is more prone to develop type 2 diabetes mellitus, hypertension, and cardiovascular diseases. Certain proteins like those from soya origin have shown to improve menopausal symptoms due to the presence of isoflavones in them. Now, what is seen in PCOS women? PCOS women generally are overweight in 50% or obese. Android fat distribution is also present in 70% of the lean women. PCOS women have more fat, and this also can be helped if we increase the protein intake in the PCOS women. How? Evidence suggests that higher intake of protein, even in girls, even in young ladies who are suffering from PCOS, will improve the glucose and insulin responses to a glucose load. The higher protein intake will also increase satiety, and this contributes to decreasing their abdominal fat. And if they reduce their abdominal fat, and if they reduce their whole body fat, then it is seen that PCO comes back to the normal stage. The weight reduction gives a good effect on your body, and regularization of the menstrual cycle and ovulation is also seen, and so the patients who are suffering from PCO, prolonged cycles or infertility, they are helped by increasing their diets in protein. What is a good quality protein? Now, what is a good quality protein? The quality of a protein is vital when considering the nutritional benefits that it can provide. The quality is assessed by 3 parameters in all: essential amino acid composition of the protein, what is the digestibility of the protein, what is the biological value of amino acids in the protein. Availability of essential amino acids. There are 2 types of amino acids, as we all know, essential and non-essential. Animal source proteins contain all essential amino acids. The plant source protein lack 1 or more essential amino acids. Then comes digestibility of amino acids. Measurement is in terms of protein digestibility corrected amino acid score. If the score is 1 or 100%, it indicates that the protein is high quality. And what is the biological value? It provides a measurement of how efficiently the body will utilize the protein consumed in the diet. So the biological value and the protein quality both are important in understanding the bioavailability and quality of different protein sources. We can see that there are 3 major types of protein. They are complete proteins, they are whole proteins: whey, casein and soya. Now we will compare upon the qualities of casein, soya and whey compared to other proteins. We can see here that digestion rate is varying in all the 3. Whey protein is high in leucine, isolated soya protein is high in glutamine and casein, and whey protein is high in leucine. So we can see that if we combine all these, the properties of each one of them are combined, and this gives rise to a very good quality of protein. A single source of protein cannot provide an even distribution of protein throughout the day. We can compare again whey, soya and casein, and we can see that the absorption rate is fast in whey. That means it is absorbed fast. Soya will be absorbed intermediately, and casein is a slow absorption rate protein. Peak level of amino acids after intake of whey is 60 minutes in whey, after intake of soya is 90 minutes, and in casein the peak levels are achieved in 3 to 4 hours. Return to baseline levels is also similarly different in all. In 2 hours, the return to baseline level is seen in whey, in 4 hours in soya, and 6 to 7 hours in casein. Amino acids, as we have already said, that in whey it is rich in leucine, soya in arginine and glutamine, and casein in glutamine. And so, if they are combined, then they give rise to combination is very good for these proteins. This stimulates the protein synthesis. There is fast initiation of muscle recovery. It helps and builds and maintains the muscle mass and lean body tissue, and this will increase the muscular mass, and it causes a sustained muscle recovery. So blend of protein beverage is capable of prolonging the blood amino acidemia and protein synthesis in human skeletal muscle. So we can see that triple blend of protein can ensure faster as well as prolonged release of amino acids to ensure all days energy and strength. Protein blend M.B.B.S rate is same level even after 4 hours of ingestion. Single source protein, the M.B.B.S rate, the muscle protein synthesis rate, was reduced by 5% after 2 to 4 hours of ingestion. So now the summary goes like this, that we have discussed that gynae surgeries such as hysterectomy, myomectomy and even simple surgeries like tubal ligation imposes a significant impact on muscle health of our women. Protein is one of the key nutritional factors that maintains the muscle strength through the muscle protein synthesis. Protein intake can help to build muscle strength by enhancing the muscle protein synthesis among women who have undergone gynec surgeries. Women in India are deficient in proteins owing to the reduced dietary intake and also the lower intake of quality of proteins which they ingest. The quality and quantity both are important, and they have The nutritional benefits are seen when the quality and quantity both are taken care of. Parameters such as amino acid availability, the type of amino acids, essential amino acids, the protein digestibility, and the biological value of protein all are important in determining the quality of protein. And a blend of proteins instead of single source can provide better protein adequacy in our daily diet. Hence, it is essential to consume a blend of high quality proteins to ensure adequate muscle protein synthesis. Triple blend of proteins in which soya, casein and whey, all of them are combined, ensures faster as well as prolonged release of amino acids to ensure good muscle protein synthesis. So apart from the dietary intake of protein powders give a combination of all these proteins, and so addition of this in our daily routine, in our daily diet is very important in order to increase our muscle protein strength and decrease our chances of getting immunocompromised and improving overall health of our women. Thank you so much.